I abbreviated part 10 in order to clean up this diagram a little bit for part 11 now. So this is a slightly cleaned up diagram. Try to imagine that you've had a workout at cross-country practice this afternoon with the coach, and you complained at the coach's office that, gosh, my muscles are pretty sore right here, and coach taught you how to bring the heels of each of your hands over your quadriceps and to actually put the heels of your hands sort of like this, the right hand on the right on your lateral vastus lateralis, and the left hand on the left side there on this right leg on the vastus medialis, and using the heels of your hand sort of leaning into the tendon right there. So imagine that, if you would, and that you imagine that you've stimulated that. And this is referred to as the tendon reflex. We had the spindle reflex before. Now we're having a tendon reflex. So here we have some action potentials coming up here through the dorsal horn, and then they're going to be divided again in two. And in this case, instead of stimulating the same muscle, we're going to relax it. We're actually going to hyperpolarize it, and there's going to actually be an increase in tone in the antagonist. Okay, so here we're coming back down here and to your sore muscle, and the sore muscle is reflexively relaxing. And it's easy to stretch it out, partly because you've increased the tone slightly in the antagonist, and you're getting the muscle to sort of let go as a result of pressing into the tendon here, the Golgi tendon organ. Okay, so that's sort of the gist of this reflex. So we had a spindle reflex, which is the knee jerk, where we tapped this part of the tendon right here sharply and caused a stretch here, which caused increased tone here, decreased tone here. Here we're just leaning in, and we're applying direct pressure to this, but not a sudden, not a percussive pressure, but just a slow, deep massage pressure to the tendon organ here. And we're getting this muscle to relax and actually stretch and lengthen slightly. Okay, this is a very interesting reflex here. It's called the crossed extensor reflex, and it's sometimes practiced in the upper extremities in sort of a martial arts kind of way, where somebody is reaching to grab somebody here on the wrist and pull, and that person has the reflex to pull back. And this is completely at the spinal, at the segmental level. You can practice this and develop the reflex, as it were, into a stronger reflex. And what happens here is that as you're being pulled this way and you reflexively pull back with your right hand, your left hand pushes. The extensors tighten on the other side. If you bring this hand closer in, then you can in fact brush off this hand that's coming. Now this is something that I would say, if you apply it to the lower extremity, it's something that we've all experienced actually quite a lot. If you live near a beach or gone to the beach, or you've walked around places barefoot, that you might find yourself stepping on a little pebble, stone, or something sharp in the ground. And as you bring your foot down, imagine that your left foot is going down on the pebble or some sharp object, and it hurts, and you quickly pull the foot up, and in essence you hop onto the right foot. Pull the left foot up, hop, and push down reflexively on the right. Okay, undoubtedly you have seen this happen, and it's happened to you. I can demonstrate it, and normally I would in an in-person class. I can't do it here. So you would just have to imagine that you suddenly pull back on your left foot as it's stepping down, and then you're bringing your other foot, or the other way, you're stepping on your right foot and you're feeling something sharp, and you jump up with the right foot and hop downward on the left foot in order to hold the position. So that's a crossed extensor, where there's flexion of one side and extension of the other side. Okay, and you can go through here with this. It's being pulled and you're pulling back. So what's being stretched here, as you can see, is that this is being pulled suddenly, and we're getting the reflex right here happening. Okay, and so the signal is going up, and we're going to be having a decrease in tone here and an increase in tone here, and the hand will come up this way. We're going to have a crossover, and there's going to be an increase in tone then to the extensor right here. There's going to be a decrease in tone to the flexor side here. So this will relax, this will contract, and we'll get the extensor to happen. So flexion on one side, extension on the other, as a reflex working together. Okay, so that's the main deal here, and that concludes our chapter on the peripheral nervous system, except of course we're going to be doing the autonomic system next, but that's going to be a different playlist. Still, it's going to be the peripheral nervous system because we're beyond the brain and the spinal cord, but we're going to be concerned with sympathetic and parasympathetic outflow specifically.